Hey there, it's Dr. Alan Bauman from Bowman Medical Hair Transplant and Hair Loss Treatment Center, and I want to tell you something about exosomes today. This is the new buzzword, the rising star, the game changer in the world of stem cell and regenerative therapies. We can use exosomes for healing and also for hair growth, and I'm going to tell you all about how we do it. So exosome therapy is the new rising star, the new buzzword in the realm of stem cell therapy, cell therapy, wound healing, and also hair growth. Well, what are exosomes and how do they work and how do we use them here at Bowman Medical for our patients? Everybody knows the benefits of stem cell therapy and cell therapy. We want to try to rejuvenate, repair, and improve wound healing when it comes to an injury or a trauma or burn, or even to reverse the signs of aging in the skin. Cells are known to do this, and we've used stem cell therapy here at Bowman Medical Group for many, many years. Usually, though, in order to do stem cell therapy, we have to take some cells out of you, process them in a specific kind of way, and then re-inject them back into the scalp and let them do their business. Well, now there's a way to use these powerful exosomes in the place of cells. Exosomes are actually the messages that stem cells provide and produce to create regeneration and repair in the skin. These are little packets of information that are released from stem cells that tell the body what to do and when to do it. Exosomes are super tiny. They're 1/1000th the size of a cell, and they contain a jam-packed load of information, microRNA, cytokines, chemokines, all kinds of information that are utilized by the cells to trigger tissue regeneration and repair. We've seen incredible wound healing results with the use of exosomes topically on the skin. And so, of course, we now provide exosomes in conjunction with hair transplant procedures, or we can. Exosome therapy is something that can also be performed as a standalone treatment for hair regrowth and hair regeneration. So much like our PRP procedures, our PDO grow procedures, now we can use exosomes as a lunch break procedure to stimulate better hair growth as a standalone therapy. It's going to take less than an hour. It's performed comfortably while you're awake, relaxed, sitting in a chair like this one, and you're not going to have any kind of downtime or recovery issues from this treatment. Exosome therapy can also be applied at the time or around the time of your hair transplant procedure. You can apply it right before your hair transplant surgery. We can apply it during your procedure and also in the phase right after your hair transplant to accelerate your healing and recovery from the procedure, and also to stimulate better hair regrowth on the back end. With our traditional PRP and PDO procedures, we normally have to take a small blood sample. With exosome therapy, there is no blood draw needed at all. Where do exosomes come from? Well, exosomes are created in FDA-approved laboratories. So these tissue banks create an exosome product essentially from a collection of stem cells that they have in bioreactors. They collect the exosomes, they quantify them, sterilize them, purify them, and then freeze them essentially, and then send them out to us in these tiny little vials. We store them in our cryo fridge, and when it comes time for your procedure, we take them out of the fridge, defrost them, and put them sterilely into our syringe. Just like PRP, PDO grow, and our other bioregenerative technologies, exosomes is appropriate for people who still have some hair that's weak and thin and wispy. Both in men and women, it can be applied and used. If you want to learn more about exosomes or think that this kind of treatment might be for you, if you're an existing patient or yet to be, click the links below and we can talk about it.